Pill or injection? That is the question, and it's not all roses or a slam dunk for either side. Some people are scared of needles, others don't want to take a pill each day. When considering taking semaglutide to lose weight, make sure to watch this video first. I'm Dr. Ryan, a board-certified physician trained in obesity medicine. You've seen the brands pop up everywhere, Ozempic, Wegovy, and Rybelsus. But how do you know which product actually works? Today I'll break down the pros and cons of injecting semaglutide and taking the oral pill form. I'll finish the video with a side-by-side face-off that will compare both forms of administration, pill versus injection, and give you my professional recommendation on which to take. One quick note, although there is an oral version of tirzepatide, we will not be discussing it in this video, as there have not been any research studies looking at efficacy between injectable and oral tirzepatide formulations. In fact, the FDA has only approved administration of tirzepatide via under-the-skin injection. No regulator has evaluated the safety or effectiveness of any oral or nasal administration of tirzepatide. Starting off with the pill. Oral semaglutides, made popular by Rybelsus, have offered people an alternative to those scared of the needle. Take a pill once a day. Pretty easy, right? That's the thinking behind most people's logic in taking the pill every day the moment they wake up. Instructions say to take the tablet at least 30 minutes before breakfast on an empty stomach, and it is recommended that food be eaten 30 to 60 minutes after the dose. However, it's important to note that you should not eat, drink, or take any other oral medications for 30 minutes after taking the pill. The reasoning is that this may decrease the absorption of the medication and make it less effective. Now that we understand how the dosage works, let's break down the pros and cons. Pros. Convenience. In comparison to its counterpart, taking a pill sounds a lot easier than finding time to inject yourself. The pill is great for people with busy schedules, especially those who travel frequently. The convenience of taking the pill leads us to our second point, improved adherence. The challenge of most weight loss plans is that some people have difficulty actually adhering to it. The more hoops they have to jump through, the less likely they'll continue to do it. The simplicity of taking a daily pill leads to people adhering to the medication and improving outcomes. Adherence is crucial for patients to achieve their desired goals and to maintain the long-term health benefits. The last pro that won't go unmentioned is reduced discomfort. Like I said at the top of the video, for people who are scared of needles or experience discomfort with injections, the pill form of semaglutide offers a pain-free solution. This removes one more barrier for patients and helps them adhere to their weight loss program. Now, I'd be remiss to not talk about the cons of taking the pill form of semaglutide because there are a couple. Number 1, absorption issues. In general, oral medications have variable absorption rates due to stomach acidity and the presence of food. This means that not every dosage is created equal, and this in turn affects the consistency of the drug's effectiveness. And if the drug is not effective, the results may not be what you hope for in your weight loss journey. Some report that they do not see the same level of satiety or fullness as they would have with the injection. Number 2, more side effects. In comparison to the injectable form of semaglutides, patients who have taken the pill form complain more about side effects such as nausea, vomiting, stomach pain, diarrhea, and constipation. This is due to having to take the pill each day, so it's a bit of a catch-22. What makes it so easy to follow can also make you sick. Number 3, piggybacking off that thought, for some people, daily dosing is actually more inconvenient than a weekly injection. Daily dosing increases the patient's responsibility to remember to take their medication consistently. Now, let's talk about semaglutide injections. For semaglutide injections like Ozempic and Wegovy, you need to inject yourself once a week, and you do this either in the front of your thighs, the front of your waist, or your upper arms generally. It is recommended that you rotate this injection site each time. Now, let's dive into the pros and the cons. Pro. Number 1. More available research. Semaglutide injections have been available longer with a robust track record of efficacy and safety. The injectable was approved by the US FDA in 2017, which is 2 years longer than the pill version. Number 2, consistent and reliable absorption. Unlike the pill form of the semaglutides, the injection goes directly into your bloodstream, skipping the digestive system, which gives your body reliable absorption of the medication. Now, if you remember from above, by bypassing the digestive system, we don't have to worry that the medication will be broken down by stomach acidity. This ensures that the drug is able to reach the GLP-1 receptors. This can lead to more stable blood sugar control and weight management. The medication's direct entry into the bloodstream ensures that it can exert its effects efficiently. Number 3, longer dosing intervals. This is more of a preference thing, as you can see for the pills you're taking once a day, but for the semaglutide injections, they're administered once weekly. For some people, once weekly can be more convenient. If it's more convenient, it'll be easier for patients to adhere to that dosing schedule. Number 4, proven results. This goes hand in hand with point number 1. Because injectable semaglutide has been around longer, it's been more extensively studied. Not only that, but semaglutide injections show better results. They've demonstrated significant benefits in managing type 2 diabetes and aiding weight loss. In clinical trials, semaglutide injections have helped patients lose up to 14.9% of their initial weight in a few months. Now, the cons of semaglutide injections. We'll start with the elephant in the room, the injections. If you have a fear of needles, this may not be the drug for you. And don't worry, it's not for everyone. Some people experience discomfort with injections, which can impair their willingness to continue with the medication. Number 2, the storage requirements. Some injectable medications, like semaglutide, require refrigeration. If you're on the go and traveling often, this can get pretty inconvenient. If you're going to take the route of semaglutide injections, you need to keep storage in consideration to maintain the medication's efficacy. Now let's compare the pill versus the injections head to head and see which does best. The 5 categories we'll judge are blood sugar control, dosage schedule, convenience, safety and side effects, and lastly, weight loss. First off, blood sugar control. Both pill and injection forms of semaglutide are effective at lowering blood sugar levels. However, a recent study published in Frontiers in Endocrinology found that oral semaglutide was less effective at lowering blood sugar levels. The study proves that semaglutide injectables are a better choice for effective glycemic control. For this reason, I'll award the point to the injectable form of semaglutide. Number 2, dosage schedule. Now, this really comes down to preference, whether you rather take a pill once daily or do an injection once a week. It's up to you to decide which schedule you'd actually follow. Since it's a subjective and really a personal choice, I'll call this a draw. Number 3, convenience. As we said earlier, semaglutide injectables need to be refrigerated. This can be a pain to deal with when you have a busy schedule or are traveling. In contrast, the pill form doesn't need to be refrigerated and is more suitable for the on-the-go type person. The ease of storing the pill form makes it the clear winner in this category. Number 4, safety and side effects. Both forms of semaglutide, pill and injection, have similar safety profiles as well as side effects. The side effects are generally mild and tend to decrease over time. However, because the pill form requires daily dosing, some individuals may experience more side effects such as nausea, vomiting, and diarrhea. The semaglutide injections, with their longer dosing intervals, may lead to less frequent occurrences of these side effects. Also, it's worth noting that you're able to microdose the semaglutide injections, which can also prevent side effects. So with less side effects in general, I'd give the injection form the point here. Lastly, weight loss. If you're taking any form of semaglutides, most likely you're taking them to lose weight. Both the pill form and the injections have been shown to aid weight loss effectively. However, given that injections can provide a consistent, more stable dosage to patients, it's more likely you'll see better results. So the pill form must battle through the stomach acidity in the digestive system, and this in turn may interfere with your body absorbing the medication. For this reason, I believe injections are the best at suppressing appetite and enhancing the metabolic effects of semaglutide. On that note, this follows my professional recommendation of using semaglutide injectables over the oral pill form. This follows a trend I've seen in my own practice. We treat over 2,000 patients and they all use injectables. As always, speak with your doctor before taking a medication. For something like this, it really comes down to personal preference. And if you're on a journey to weight loss, join our Lean Fast RX community and we'll send you tips on how to achieve the body of your dreams. Stay tuned for more videos on healthy and effective weight loss and fitness strategies. Click the link to subscribe for future updates and feel free to write any questions in the comment section below. Thanks. I'll see you in the next video.